Hello, this is Robert Menard of the Northern California Kaiser Permanente Craniofacial Clinic. In this program, we will be looking at the methods for prevention, as this information will be helpful for both preventing and reducing flattening. Why does this flattening happen? It is a result of outer molding forces on an infant's skull, which reacts to pressure like a cardboard box. Here we see a 3D CT scan of a baby with a normal-shaped skull and a cardboard box. When pressure is put on one side of the back of the head, there is compensational bulging on the opposite side of the back of the head to help the growth of the brain. This flattening is a safe process, which results in a cosmetic deformity of the skull, and there is no strong medical evidence that untreated flattening has any medical or mental concerns for infants. To reduce your baby's risk of SIDS, or sudden infant death syndrome, the American Academy of Pediatrics has recommended that parents put babies to sleep on his or her back. While this increases the risk for developing a flat spot on the back of your baby's head, affecting 1 out of 5 infants, the benefits outweigh the risk of a temporary abnormal-shaped head. The following can prevent and may decrease flattening. Reduce the amount of time your baby spends lying in one place. This includes on a mattress, in a car seat, on the floor, or any firm surface. Modify sleeping positions. All babies should be put to sleep on their backs. You can change positions by placing your baby's head at the opposite end of the crib on alternate nights. This will encourage your baby to turn his or her head a different direction every other night when he or she turns towards the sound of your voice. Carry your baby in your arms, sling, or other carrier more often. Provide tummy time each day during playful awake hours. Tummy time relieves the pressure on the back of the head and increases neck strength. Tummy time is essential in preventing plagiocephaly in infants. You should begin tummy time as soon as you take your baby home from the hospital. Tummy time helps promote motor skills development, such as rolling over, sitting, and crawling. It will strengthen your baby's neck, abdominal, and back muscles and make your baby stronger. To encourage tummy time, place your infant on their tummy on a towel or playmat on a solid surface such as a floor or crib. Place a toy in front of them and engage your baby in play. Do tummy time as often as possible when your baby is awake and not hungry. Place mobiles and other interesting toys so that your baby must turn away from his or her flat side to see them. Rearrange furniture in your baby's room. Even very young babies are attracted to light and will try to turn their heads towards a window. If your baby sleeps in your room, set up the bassinet or crib so that he or she must turn away from the flat side to see you. We do not recommend any kind of support or device that restricts baby's head movement. Do not use wedges or sleep positioning pillows, as these can be unsafe. Switch arms each time you feed your baby, whether you bottle or breastfeed. By alternating arms, you are placing your baby's head in a different position. Most mild cases of plagiocephaly improve with the treatments described above. If the flat spot or abnormal head shape is significant, or if you notice bulging on the side of the head opposite the flattened area, please contact your pediatrician. We can usually diagnose the cause of an abnormal shaped head by viewing and feeling your baby's skull. We will ask about your baby's regular sleep position and possibly measure his or her head. Try to remember that your baby's shaped head, if due to positional molding, is not a concern for overall health. Plagiocephaly is only a cosmetic issue. On behalf of the Craniofacial Clinic and Kaiser Permanente, I want to thank you for taking the time to view this presentation. If you have any questions, feel free to contact your pediatrician. We look forward to caring for your child.